Is it normal? Is it normal to have an elevated white count after surgery? And the answer to that is yes. So usually a white count, which are the cells that go to fight infection, usually if you're sick with some type of infection, so let's say you have strep throat, and somebody measured your blood and they looked at the number of white blood cells in your bloodstream at that moment. Remember, taking the blood is a picture of what's circulating in your blood at that time. And if you have a strep throat, then you might see, or you will see, an elevation, an increase in the number of white blood cells that are circulating around in your body because they're fighting an infection because you have strep throat. If you have surgery and you get your blood drawn the next day and they look at the white blood cell count, it will also be elevated. That doesn't mean you have an infection. It's virtually impossible to have an infection the next day after surgery. The other thing is fever. So if you have a strep throat and you have an elevated white count, you're going to also have an elevated fever. We normally consider a fever anything more than 101.5. Because you're sick, you have an infection, you're going to have a fever. But after surgery, if you take your temperature on the first day after surgery, then it's normal to have a fever. It's totally normal. So an elevated white count after having surgery or a fever after having surgery within the first 48 hours is normal. It's to be expected. Most people will develop it. Why do patients develop a fever after having surgery? It's because there's collapse of the little tiny airways at the base of the lungs. It's called atelectasis. And that happens to everyone because we're not breathing our typical way during surgery. We're breathing for you, but it's still not exactly the same. And so some of those little airways at the bottom will actually collapse, and when they do, that triggers your body to raise the temperature, and that's where you get elevated fever from. So a fever within the first 48 hours after having surgery, not an infection. Elevated white count during the early part of your recovery after having surgery, not an infection. Now, if at 30 days you develop a fever and you develop an elevated white blood cell count, then it's going to be infection. You're not going to say at 30 days, oh, it's because of the lungs. No, it's not. That is normally signals an infection. So it's important to understand that if you do have a fever and elevated white blood cell count, outside of that early postoperative window, then you have an infection. Early, within the first 48 hours, to be expected, not to be worried about.